Good morning, everyone, and I'm going to take you through a talk on imaging the optic disc with the OCT. This is the parapapillary retinal nerve fiber layer that is picked up. It's a little bit hard for me to look like this, so I don't think I'm going to use my pointer too much, although I would have liked to very much. So this is the parapapillary retinal nerve fiber layer, and you can see the changes here. There are retinal nerve fiber layer defects both superiorly and inferiorly, and the retinal nerve fiber layer is not only assessed simply by looking at this red and green, but you also look at to see whether it's circled, whether you're using the foveal optic disc alignment, or whether you've gone on to the new software that's been released where it's not the optic disc alignment, but it's the foveal Brooks membrane opening alignment. You also look at the tissue of the retinal nerve fiber layer, and you can see a classical retinal nerve fiber layer notch that corresponds also to the notch that you see in the optic disc actually. The retinal nerve fiber layer thickness change indicates optic disc damage, and this is a photograph that shows that there is loss of inferior rim actually, and there is some loss of superior rim also. And if you look at the photographs here, you'll see that there is a loss superiorly of roughly about 15 microns and a loss inferiorly of about 20 microns actually. Now sometimes these changes on the optic disc are very hard to evaluate because you just have unidimensional optic disc images, and most of us don't have access to or are not spending enough time taking stereo photographs. And I think that sometimes if you have a follow-up of the retinal nerve fiber layer, that can help you go back to the optic disc and take a look and see whether optic disc damage correlates with the retinal nerve fiber layer loss that the OCT shows actually. So sometimes you have retinal nerve fiber layer change, and the change is roughly about 5 to 7 microns superiorly and inferiorly, but you're not able to make out any significant change. Of course, you can see that the color of the optic disc is very different. That often happens, depending on who's taking the image, and that can cause a great amount of difficulty, especially when you're looking at very minor changes to identify as far as the rim is concerned actually. And here you can see that there is loss of 7 to 12 microns both superiorly and inferiorly, but however hard we took a look at the optic disc, we were almost unable to make out any rim loss actually. So there is a possibility that sometimes rim loss may not become evident when retinal nerve fiber layer loss has become evident actually. And this is another photograph where there is about 13 microns loss of retinal nerve fiber layer inferiorly, and superiorly there is just that little bit of loss of the inferior rim actually. So again, if we had just seen this patient off very quickly and not compared the photographs, then we wouldn't have been alerted to the fact that there is optic disc damage that is going on actually. In a normal subject, this is the retinal nerve fiber layer. This is the ring about 3.4 or 3.5 millimeter ring around the optic disc. And you can see a small line that's going from the center of the optic disc to the fovea. So that would align the fovea with the optic disc center. And so that would help to take care of torsional elements to some extent, so that you may get slightly more accurate retinal nerve fiber layer readings when you're assessing for the retinal nerve fiber layer with the OCT. And now, of course, that there are 3 scans of the retinal nerve fiber layer that you can get. So you have an inner circle, you have a middle circle, and you have an outer circle. And this can to some extent take care of the problems that you get, especially when you have large areas of parapapillary atrophy. I still do not know the exact clinical significance and how it's actually going to help out, but we hope that by doing the outer circle, perhaps we may be alerted to early retinal nerve fiber layer loss, though it's too premature to say anything like that. So this 3 circle also uses the foveal optic disc alignment. And this is the retinal nerve fiber layer with, but there's nothing much that I'd like to talk to you here. So this is the 3 scan RNFL in glaucoma. And you can see here that this scan again allows you to take a look at the different readings here. When you go from the inner to the outer circle, there is slight thinning actually. And we still haven't enough data from our normal patients actually. So I don't know how, when you go from the inner circle to the outer circle, how whether there is a decrease in the percentile or whether there is, what is the level of decrease in the normal values of the retinal nerve fiber layer. But you can see that in general, except for the middle circle, the inner circle and the outer circle seem to have same colors, so that roughly the percentile loss of retinal nerve fiber layer is constant in the inner circle and the outer circle, but not really so much so in the middle circle. So these are all things that are very hard to understand for the time being, till we have a few more years of experience to go with it. There is something else also that we need to learn about, and that's the Brooks membrane opening and the minimum rim width actually. This is a software that identifies the Brooks membrane, creates a circle, puts the circle on the optic disc, and then it divides the optic disc into several segments, and then it takes each segment and it measures the point from the Brooks membrane here, that's the Brooks membrane opening, the tip of the Brooks membrane, to the smallest distance to the surface of what we call as the neuroretinal rim actually. So that's the minimum rim width actually, and the opening is the Brooks membrane opening and the minimum rim width. Both of them are used to get details of what constitutes the minimum rim width, and the minimum rim width also from the normative data that this program has in the Heidelberg Spectralis. They've come out with the percentile values, and of course you can see the graph is quite normal in this patient, and we took a normal patient. The red line that you see here is the opening of the Brooks membrane, and we learn as we go along that the red line of the Brooks membrane does not often correlate with the margin of the optic disc, even when you're talking of an emetrope, even when there is no parapapillary atrophy, even when the patient is not myopic, even then the Brooks membrane will not always correlate with the margin of the optic disc, although there is a statistical correlation, but it doesn't really tell you the margin of the optic disc actually. So you get all these segmental values, and the red, the green indicates that it's within the normal percentile of, and this is the minimum rim width in primary open angle glaucoma. And you can see the graph dipping down. This is a typical glaucoma patient, and you can see that the zones are all red, and you can see that there's hardly any rim left here. And so this is what we may end up following, but we can't really say whether this is going to be any better than just doing a single scan retinal nerve fiber layer. I think time will tell us, and once we start correlating all these changes. So this is again different segments, and they tell us, the yellow tells us the percentile value, and it tells us that this is a suspicious area, and of course you've already seen the images before actually. The optic disc size is very important, and when we did the enhanced depth imaging for the optic disc in small optic disc, we found that you get a very small dipping of the cup here actually. And so just by looking at the line image passing through the optic disc, sometimes we can tell ourselves that this is either a normal size disc, or that there's no suspicion that it has glaucoma, or that it is a small disc. Now this is a large disc with a large cup, and you can see that with a scan going through the optic disc, how it dips down like this actually, and this cup here is of course much deeper than what we saw just before, and that is quite normal with large discs actually. And then we look at the shape of the optic disc cup with EDI with this horizontal scan, and you can see how it dips inside even more. And then when you do a vertical scan, it gives a kind of rectangular shape to the optic disc actually. Of course, there are many parameters here that indicate to you simply from the EDI that this patient is very likely to have glaucoma actually. And this is the beta zone that we know of so well in glaucoma. And when you pass an enhanced depth imaging, then you'll find that the Brooks membrane reaches right up to the margin of the optic disc. So this point correlates with the margin of the optic disc here actually, and this point here correlates with the margin of the beta zone. So it's just another way of figuring out where the beta zone lies. But what is important is to differentiate the beta zone from the parapapillary atrophy of myopia. And when you look at the optic disc margin, then the optic disc margin is this line here, and what you get here, this is the Brooks membrane edge actually, and that correlates with this margin of the parapapillary atrophy, because the Brooks membrane migrates away from the margin of the optic disc, and that's why if you had a circle around this area and the circle of OCT retinal nerve fiber layer cross this area, then of course, because there is so much atrophy of the retinal layers, you'll see the line dipping down, and then it's not such a good scan to be able to correlate. And this also tells us where the CSF lies in the area of parapapillary atrophy, just beneath the area of parapapillary atrophy. And this is just to give you a couple of slides on the lamina cribrosa that we're able to see, and how the lamina cribrosa would change from a normal to someone who has myopia or someone who has glaucoma. So this is generally a very normal lamina cribrosa, and you get this area of retinal nerve fiber layer here, which is very prominent just above the anterior surface of the lamina cribrosa. And in glaucoma, you can see that there is loss of this tissue that I was talking about actually. These are things that we still need to figure out how to understand, but there may be some value of the retinal nerve fiber layer tissue just above the lamina cribrosa to tell us a little bit more about these patients with glaucoma. Thank you all very much.